All right, welcome everyone. We have our first session in our new series of Boosters and Beyond. This one is focusing on readmissions through a lens. So each week we're going to be talking about various different topics that could be contributed to your readmissions. And this week we have Dennis going to be talking about C.diff. So if you're not familiar with who we are the IPRO QIN-QIO. We are a federally funded Medicare Quality Improvement Organization network, and we cover these 12 regions shown here under CMS. IPRO specifically covers New York, New Jersey, and Ohio. Health-Centric Advisors covers Connecticut, Maine, Massachusetts, New Hampshire, Rhode Island, and Vermont. And Clarent covers Maryland, Delaware, and the District of Columbia. So together, we fall under the IPRO QIN-QIO. At this point, I'd like to invite Mary Ellen to talk a little bit about our COVID-19 vaccine booster update.
Thanks, Josh, and hi, everybody. Just to give a brief COVID vaccine booster update to date with the bivalent booster, there's been 14.8 million doses received as of October 12th. Looks like a big number, but in actuality, at this point, we only have a little over 46% of adults older than 65 having received a second booster. So certainly work to be done there. The latest variants, CDC does update this weekly. As of the 1st of October, the combined lineages for the Omicron variant that are circulating, it is 100% circulation, and you can see the various strains that are out there. But right now that BA4 and BA5, the one the bivalent covers, is the predominant lineage, and it's projected to circulate for the next coming weeks at about 68-70%. And just want to give people a heads up that they are tracking yet another variant for the COVID virus, and this is the BQ1. You may have heard about it. It kind of popped up on the epidemiology radar, if you will, last week, and that is starting to circulate, where they're seeing about 10% of circulation on this new BQ1 strain. So more information to come as far as how well the bivalent vaccine will cover that particular strain. And lastly, if you haven't already joined, we have our Vax Chat series every 2 weeks, and our next session is this coming Thursday, the role of vaccine champion. So we encourage folks to register for that. It's a quick 15-minute session on that particular topic. And that's it. Thanks, Josh.
No problem. We do have links for documents that are helpful in regards to vaccinations that can be shared as well. And again, as a reminder, this is a new series. We're going to be reviewing various topics that can contribute to readmissions and strategies to address those topics. And today is actually a very unique session because we're going to introduce a tool to review C.diff and its implications, as well as strategies to address it and prevent the readmissions themselves. And there's actually going to be some additional opportunities for you to be able to continue this education specifically with C.diff and work in work groups. And we encourage you to participate that if able. So next week we have another topic which is separate from this unique session today, but we're going to continue the series as normal and then offer those additional work groups for anyone who may be interested. And with that, I'll pass it over to you, Dennis.
Thank you, Josh. So as he mentioned, today we're going to talk about C.diff. Next week, I think it's UTIs. But this week, we are going to do something very unique. We're introducing a tool, as well as going to tell you about some work groups we're going to put together. Please, if the whole description that I'm going to go through and everything gets confusing, ask questions in chat. I've got a whole team of people that is willing to help answer questions. So today we're going to review C.diff. the impact on residents, review infection control applications, and some best practices in preventing readmission. Next slide, please. So as we know with C. diff, one case is too much. Many times in long-term care where, we come across one person and they have C. diff and we're like, well, it's just one situation. But with C. diff, it spreads so quickly and so easily that just having one situation in one of our homes really is too much. And with using antibiotics so freely the way we have in the past, it's very difficult to treat. And as this little cycle shows, we get antibiotics. Next thing you know, it's on environmental services. We share it because we're not washing our hands with soap and water, or not washing the surfaces with the right cleanser or dwell time. And next thing you know, everyone has it. So we really need to be aware of it. Next slide, please. So from the CDC has what's called a TAP assessment, a targeted assessment for prevention of C. diff. We found this and edited a little bit to help and use it to determine what area for improvement your facility could and should focus on. We've got it on paper as well as electronically. We put it in REDCap, and we're going to, in this program, walk you through starting to use the REDCap assessment. And then we're going to invite you to fill out a couple sections in the REDCap survey regarding C. diff. That's going to allow us, and only us at IPRO, to look at data. And it's going to be blinded and only aggregate data. And facilities, no residents will be shown, but we're going to be able to compare data and demonstrate, where are states, counties, opportunities for improvement. You'll be able to see in your facility where there may be an opportunity for improvement. Is it with contact precautions, antibiotic stewardship? Is it with your policies? Is it with hand hygiene? Then we have a whole plan to help you improve this area that may be an opportunity for improvement. But first, I want to ensure you that nobody can see anything that you put into the electronic assessment. It's blinded, aggregate, and only we will be able to see it. No one else will see your data. It's not reported to CMS or anything else. It's just, us. Next slide, please. So this is the first page of that targeted assessment for prevention TAP tool. And we're going to be asking you to do these questions in a moment electronically. Next slide, please. And this is just a screenshot of how it looks. It's broken up into sections. And there's, a place for comments, yes, no. Unknown is a perfectly acceptable answer because it just allows you, and when we're compiling information, allows us to know where we need to develop more information for people. But this is, as I said, just an eyeball look at what it kind of looks like. Next slide, please. So the different sections in this targeted assessment for prevention tool it starts with the general infrastructure, capacity, and processes at your facility. Then there's a section on the training specific to C. diff. It goes through hand hygiene, PPE, contact precautions, and environmental cleaning, and breaks those sections down into questions to determine if your facility has training, knowledge assessments, and skills assessments on each one of those categories. Then there's a section on audits and feedback on each of those sections. Then there's a section on antibiotic stewardship, early detection and isolation, as well as appropriate testing, contact precautions, hand hygiene, as well as environmental cleaning. I know it sounds like it may be overwhelming and a lot of information, but you'll see it really isn't. It's pretty short and quick to complete. Next slide, please. So the overall plan, and I'm going to go through the plan a couple times, is during this section, we're going to provide a link, and individually, we'll have you guys click on this link. We'll put it in chat and we'll open it on the screen, and we'll start everyone together entering some information. Demographic information, your facility, some other information. And then there's just 6 questions to begin the first section of this assessment. Then we're going to go to the end of the page and click submit. Again, yes, no, unknown, all are acceptable answers. If you're not sure if you have a policy, that's fine. If you're, if the answer is no, that's fine also. It's just to determine the awareness and where we need to focus our attention. So after we do that, at the end of this session, we'll send everybody here, all the attendees, links to finish section 1, then section 2 and 3. And then in November, we're going to have a work group, and we'll go through the data and discuss best practices and give you resources to address any areas of improvement that you may have identified for section 1. Then December, we're going to have a work group to do the same for section 2. We're going to go over numbers and the assessment, give you resources and best practices. January, do the same thing. In February, as you all know, every year we have to do a facility assessment of our whole facility, and we have to do an infection control assessment. Annually, it's just standard. We'll also suggest that maybe you do another one of these assessments and see if you've improved your C.diff processes. It will also indicate how your antibiotic stewardship is, and then in March, we'll meet again and see if overall we've improved your blinded aggregate data. So that's the whole big plan. Next slide, please. This is one of the tools that we have we have a whole kit that we're putting together that we'll be able to share with you for best practice, for education for your team. This is a flow sheet for your facility so that they can help determine what exactly is the appropriate process. When do you send a test? What symptoms are appropriate? Have I ruled out certain things? Next slide, please. And this is a document that we're putting together. It's not complete yet, but just like I went through all the sections in that TAP assessment, we're going to have resources for each section. So if you identify a section where you may need a little bit of support, we're going to have resources that you can use to address those areas, as well as in the work groups, we'll discuss best practices. So you'll have something to be able to, if you don't have a skills assessment or you don't have, pre and post tests or whatever else, we'll have that for you. So you don't have to do work. We want to do the work for you, address the need. And this can be a QI project also that you'll be able to show, no, this is not just for long-term care. This could be for any setting. And this is also could be your QI project for you, because we're going to have baseline data and future data and, you know, the process. Next slide, please. So my friend Terry put in chat, and I'm going to put it again, the link. If everyone can click on that link, we're going to open up, and Josh, if you're able at all, otherwise we're going to open up. Oh, Josh, you're the bomb diggity. And we're going to walk through this together. So hopefully everyone's able to open that link. If not, please pop a note in chat, and we'll start, you know, with the date of assessment. And today is 10/18. And your facility name. And for Josh, yep, thank you. And your facility address. If you're not aware of your facility CCN, you can look it up at that tool that's linked right there. And I don't even know how to nursing homes. Look at Josh, getting you all the information you
This is
need.
the actual website that you need to go to. So I'm putting
Okay.
this in that for you guys. You can get your
Okay.
information.
Awesome.
And then
The name of whomever is completing the tool. It does not have to be any particular individual. Your role, or if you're the administrator and you're going to have the infection preventionist kind of be your lead, you know, that's okay. Your years of experience at the facility, email, so we can send you the links, the phone number for the person. We're not going to spam you or anything, but just in case we do have a question. So now, is this assessment going to be completed for your entire facility, or are you going to focus on one unit? And that's completely up to you. So facility-wide, or one, if it's not, and you're going to just focus on one unit, you know, that's absolutely your prerogative. Unit name, and this is kind of for your tracking, and then the unit type. So you can say whatever, unit 1 rehab or short, yep. And then what shift? Most likely it's going to be day, because that's what we're kind of doing right now. And then we're going to go through the next just 6 questions. Does your facility have a policy related to C. diff infection? If you're not sure, unknown is fine. If you know you don't have one specific to C. diff, that's fine too. Does your facility's senior leadership actively promote prevention of C. diff? Yes, no, unknown. Again, there's absolutely no wrong answer. Does your facility have a team or work group focusing on specific C. diff prevention? Does your facility have a clinical champion for C. diff prevention? And a lot of the answers probably are going to be no, because a lot of facilities haven't really made C. diff specific, you know, work groups. Is unit level leadership involved in C. diff prevention, or is it really just the infection preventionist? And does your facility have unit-based staff champions for C. diff prevention? And after that, we're going to scroll all the way to the end. We're going to hit submit, and that's just going to save our answers for today. And scroll down and click. Well, this shouldn't pop up. We didn't put in a CCN, so we've got a, it wants to make sure it can find you. So if you have any questions regarding this, please reach out to one of us. Next slide, please.
Yeah, if you don't even know your CCN, you can reach out to us and we can get that for you as well.
Absolutely, absolutely. So the next step, again, we're going to send you links to have you complete the entire assessment, the rest of section 1, and it's very similar to what we just did. You're welcome to pass the links off to your infection preventionist or whomever. It doesn't have to be, the administrator or director of nursing. It won't let you submit because everything is not filled out. Most likely, Gina, yes, you have to, there's probably something missing. You'll be invited to work groups after, anybody in attendance will be invited to work groups. And we'll send you those invites. And the work groups are going to be to assist facilities to choose an intervention and implement the intervention, and to help coach you through the quality improvement process for C.diff. So like I said, this is going to count as a quality improvement project. Work groups are going to be sharing best practices and resources to improve gaps in the section and just focused on aggregate blinded data. Next slide, please. So the first work group, and we'll send you invites, will be November 16th, 1 o'clock, and we're going to review the initial data in section 1, resources and best practices. The next work group is section 2, and you might want to invite your consultant pharmacist because that's the section that has antibiotic stewardship, or invite anybody that may be interested in that portion. And then the third work group involves environmental cleaning, contact precautions, and some of those other topics. So you may want an environmental services representative. In February, we're going to reach out to you with a reminder and a link to ask you if you take the time to complete the assessment again as part of your annual infection prevention assessment and see what's improved. And then in March, you'll be invited to meet with us again, and we'll look at all the blinded data and see where we may have moved some improvement. Next slide, please. We do have a couple of videos. Susan, if you'll put your facility in, somebody on the call can look up your facility and put your CCN number in there. We do have a couple of videos, and we're going to play a small clip in just a minute. But we've got some videos so that you can really understand the impact of C.diff. You can use it with skills fairs, new staff orientation, onboarding, or with your leadership. Next slide, please. I love this cartoon. So if you want a fun way to try to share with your staff the importance of C.diff and how quickly it's spread, this is a fun way to, do a little education. Next slide, please. If anybody has any questions, pop them in chat. And I think we have a link to some questions that we're wondering if you guys could ask for us again so that we can do some education and meet all of your needs. But I'm going to look up a couple CCNs if anybody.
Dennis, I'm doing it.
Oh, thank you. Okay, so you've got Lisa, Susan, Laura.
Yep, you can always contact us for your CCN as well.
Yes.
And while Darlene is working on getting those CCNs, I can play the video for everyone for the patient story. And that way we can, leave with some motivation from today's call. Can you see this still?
We see, yes, the contact information.
Okay, hold on, I have to.
Now the video.
Oh, it did. Okay.
Yep.
All right. So I'll get started with this.
Isolation precautions. And that was probably, I don't know, 8 or so months into the experience. I think, honestly, there were, of course, everyone that had a hand in saving my life is, I'm forever indebted to and grateful for. But there were 3 people that really stood out. And a couple of them even surprise me still to this day. So one was an environmental services worker who was there what felt like all of the time. But she would come in every 8 hours and wipe down the room and, that sort of thing. And she had been there so often when my children were visiting and recognized that I couldn't remember their names or that I was having trouble getting a sentence out, or I would forget little situational things and repeat myself frequently. So in the times while they weren't there visiting, she would sort of quiz me on their names, like, oh, I have pictures in my room. Who's this one? And well, how old is that one? And that sort of thing. And it really helps solidify that repetitive nature of our relationship. Helped solidify for me where I was sort of in reality. I had because I was so confused and earlier on in my recovery. And again, another surprising thing was that the folks that came in for nutrition services so often with 3 times a day, I was in a period of my recovery where I was learning to eat again, right? I'd been on TPN for so long, so I was learning to take food in orally. And so they would come in with the menu, and I apparently every time there was a meal, I asked for chicken. And it was the nutrition staff that recognized that I couldn't read the menu, couldn't understand the menu. And so they took all this time with me to really go through and help me re-identify words. And then that evolved into a relationship where they helped me with my cards and the clock. And eventually I had myself a little journal, and I, in my boredom had started to write down the hours as they went by. So 2 o'clock alone, watching, a cooking show, etc., that sort of thing. And one day, just out of curiosity, I just added up all of the time I had spent alone, and the average for like the last 10 days in my little journal had been 21 hours alone a day with the nurses, with the doctors, with physical therapy, occupational therapy. I mean, every discipline you can imagine that is partnering in care, in addition to my visitors, 21 hours of that day, part of it you would imagine would be sleeping, right? But was alone. And so I was able to articulate that to my nurse, who one in particular I felt was very dedicated to me. And when I expressed that loneliness and that depression that I was having, she sort of changed her pattern of work, and instead of charting at the desk, charted in my room, so that even though we weren't necessarily having a conversation all the time, there was someone there.
Join us for more support. How? Contact Teresa Lebowski, pharmacist, quality improvement, medication safety, lead nursing home quality improvement initiative.
All right. So we hope you enjoyed that video of a patient experience who went through C.diff themselves. Definitely is impactful to hear firsthand from a patient and to learn from that. So any questions in regards to the sessions from today, I see that there was still some CCN requests coming in. Darlene, did you need any assistance or with that last couple of ones?
I'm trying to work on them too.
Okay.
I've been trying to do some direct messages because what they put in there isn't exactly what we have, so I don't want to give them something wrong.
Mhm.
So I'm down to Jennifer and Jorlene.
Okay. I can work.
And if you could put your state in there too, that's helpful. This is Terry. You can put your state in there so we can send it back to you by a direct message.
I've got Jorlene Dreams. And thank you everyone for your your excitement and willingness to do this. This is great.
Okay, Dennis, can you help me with Jennifer's also then?
Yeah, Jorlene. Let me just send Jorlene hers. Does anybody have any questions regarding the tool? Any of the steps for this whole process or anything?
I just got Jorlene's sent to her, Dennis.
Okay, so now we're all looking for.
Jennifer.
See who gets it first.
Yeah,
I think I've got it. It's in. I think she says New York.
Valley Stream, New York.
Okay, I've got it.
All right.
Yay.
Maria, what facility are you from?
Oh, there's Dawn is saying from, she's got Cincinnati, Ohio.
Okay, I'm getting in there.
Is anybody else having trouble hitting the submit button?
All right, Maria, your CCN I just sent to you.
And Dawn, I'm working on yours. Yeah,
Oh, it's saying that they have to fill out the rest of the form when they fill out the first 6 questions.
that doesn't make
It didn't.
Terry, are you still on, Terry?
Yeah, I am. Yeah, just keep going with just keep accepting, just keep submitting and accepting. And I think it will accept the data.
Dawn Duncan.
Yeah. Let me.
Okay,
won't let them-
Dawn.
It won't let her just submit the questions that they did. It's saying that there's questions.
Yeah, but just keep going. Like keep
Just fill them out.
yeah.
Okay.
No, don't fill them out wrong though. Yeah.
Oh, okay.
No, wait, I'm just going through it now. Let me just get to the trick.
Yeah, something must have happened.
Yeah, Joanne said that you have to answer the entire form, not just the questions we reviewed.
Judith, are you looking for your CCN?
So when you click OK, right? Did you click OK at the end of that?
Okay, Bianca's saying on my end, it says that it is saved, but that the other questions were not answered.
Right,
Yep.
That's fine. That's
Yep.
fine. That's
And that
okay.
you
Yep,
should be able to
just
just
click
go
OK.
back.
Right. You can go back at a different date and put in a new date in there and then finish all the others. But at the
Oh, and-
bottom, make sure you click that OK when the big box comes up saying you didn't finish.
Oh, okay. I don't
That
think-
is okay, not to finish all of them.
All right,
And-
so at the very bottom, there's a box that says okay. And then that should be, everything should
Right.
be saved.
Yes, yes. It'll be saved under today's date. So when you go back in to answer the others and you fill in the rest of the form, it'll be saved under that new date. And then in the back end, we'll combine the two.
Okay. That's
Okay.
great.
Yep.
Judith Clement.
Yes, I
you-
just put her CCN in.
Okay, perfect.
Really, guys, thank you so much for jumping all over this.
Yeah.
You guys are awesome.
All right, I'm going to just put up our contact information again.
Yep.
For just like another minute. That way, if you still need your CCN after we end the call, you can feel free to reach out to us, let us know what facility and state you're from, and any one of us will be able to get that CCN for you to be able to plug it in.
Yeah.
And if you're all set, we're finished with the call, but if you need to take another minute or two to get our contact information, I'll just leave this up for another minute.
And I'm putting our emails into
Emails in.
chat.
Perfect.
Thank you, Josh.
You're welcome. And with that, we'll end this call for
Yes.
today. If you have
Thank
any
you,
questions
everyone.
again, just feel free to reach out to us. Thank you so much.